Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk about something today that all dentists working on children should know this. And this is something that I think every dentist that's going to work on children should understand how to do a pulpotomy on a healthy, deciduous tooth without all this rigmarole. You cannot use a rubber dam when you're going to cut down under the tissue like this. But let me go through this case and show you. It's going to take a little while, but this is something I think every dentist that works on children ought to know. Now let's get going here. There's a real nice young lady here, and her mother and parents brought them in, and they have a problem that you see all the time in dentistry. You're looking in somebody's mouth, and here comes a child in, and they've got the three of the permanent teeth are sticking out here, and the other one is crowded back down behind the cuspid and behind the root of this tooth right here. You see that crown is kind of leaned back here. The root's being pushed out down at this bottom. And if we know how to deal with this, you can do so many things that it will surprise you how you let nature do the straightening of the teeth. And this is by far the best way to diagnose. I don't care whose system of diagnosing, it is not as good as nature's system. Now let's watch this as we go along. Now we're going to allocate this space out, but we'll come over here and we're going to have to take some of this tooth off, and you do the same thing on the opposite side over here. Now let's look in the mouth and just take a look at this. You see you're crowded on both sides. You're going to have to do this on both sides of the mouth. All right, you can see the tooth just peeking up down here. Now let's look down on the upper now. We're going to be crowded too, and we're going to have to come down and do some space allocation up there too. I did this way back there when we didn't have to wear gloves or anything, so don't condemn this to start with. This was way before we started wearing gloves. Now we take this and look down on the bottom teeth, and you see this left lateral sitting right in there. I'm going to erase that and you can see it. Now, in order to do this, we're going to have to take this tooth off at a kind of a curvature right here to keep from touching that tooth. Now in this one I took some of the tissue out just to see the tooth as we went. We didn't need to take it out. And so let's get started and show how we did that. Now we take the teeth that are in there and you look and you see this. There's no question about the crowding problem. And now there you see this, the tip of that tooth. Now we used, back when we started this, we used a long tapered diamond. You just got a brand new one for every case. But I got where we used 1171 long carbide burr toward the end of it, which is easier to go from one tooth to the next without problem. So anyway, you can use either one of those to do this pulpotomy on the teeth. So we'll go here. Now you take that, and I never did in the jaw. I'd put a drop or two of anesthetic on both sides of the mouth, and wait just a little while, and go do something else, come back and deaden that tooth, just infiltrate anesthetic down around the root, and the tooth would get numb completely. Now we take that diamond, and we come up and we go right straight down through the tooth. And you can't put a rubber dam on there, and you're going to be grinding into the tissue a lot of the times. Now we take that on down, but as I get close to where this tooth is, I stop, put something in there and pop this tooth off, this piece off of the tooth right there. I don't think I show that, but we get out here and we'll come back and cut it down here, and we're going to take the root of this deciduous cuspid down. Now, people who think, well, it's better or it's so simple to extract this tooth, but if you take this tooth out, then this cuspid that's underneath here comes up and takes that space, or takes a lot of it, and you're going to lose arch length if you extract this tooth. So we're not going to lose anything. So we're going to go down here and take this off. Now the the permanent teeth, they're wider up here at this part of the mouth, and as you get out here, they narrow up, and the root of the permanent teeth are usually quite narrow down in the bottom. So when you get in place, the crowns, once they come here, can slide into place, and the cuspid over here will come up and slip them together. And just nature will push these teeth. It'll amaze you what it can be done if you just kind of help them a little bit. So we're going to do this pulpotomy. Now we take that burr and go right down the middle of that tooth, watching that we don't touch this permanent tooth right here. But we cup this out. You can't do this with a disc now. And we'll just run this burr down into the pulp of this tooth, going down in here somewhere. And we do not try to dry it or blow it out or anything. Just let it bleed. And I do not use anything but zinc oxide and eugenol. Now, I've lectured on this for years, and I was in Boston once, and I had the heads of 3 pediatric departments there, and they all thought you got to stick something else in here. Don't do that, because part of this zinc oxide and eugenol can come out, or as the permanent cuspid coming underneath here eats the root of that tooth away, it can leave the zinc oxide and eugenol has no ill effect on the structure there. It'll just come off and come out with the rest of it. So do not add anything to it. It's pure zinc oxide and eugenol, but you've got to pat it out till it's so thick you can pack it like amalgam. All right, here we've rolled this out. We put a stack of eugenol and put just a drop or two of this is zinc oxide. And you put a drop or two of the, and then mix this up real good like you, and then pat it out on paper. You mash it out until you get all the eugenol you can out, and roll it into a pencil shape, something like point of a pencil. Take a spoon like such and cut it off right here, and then all you have to do is take that, and it'll stick to the spoon. Now we're going to take the spoon and come over here and let it bleed. Don't worry about the blood or anything. And you pack that in there just like you were packing amalgam. We'll take that and shove it right down in the middle of this, and it'll stop the bleeding. What blood is left around in there, it kills the bacteria. And if you squeeze it out the root, it doesn't hurt. Or if you fill the root up, or if you don't quite get it filled, it doesn't matter. Now, I have literally been doing this since in the early 60s or before that. I learned this from an old pediatric dentist that came to Fort Worth and spoke from Shreveport, Louisiana, and he was telling about doing these pulpotomies on case, and I started doing that. Now it takes 8 of these for each case you do. So I know I've done 1,000 of these things on just many people that we've done them on. If I didn't do 1,000, it's several hundred, 900 or more. And you pack this in there, and I have never had one go bad. Now, there's one that did bad in the case we showed, but it was done by an old surgeon with a MD degree plus, but he did not know how to do a pulpotomy on a deciduous tooth. So, and he screwed it up. It went bad, but the problem, everything went off fine, even though the tooth kind of blew up on him and it abscessed slightly. Now let's see, we're going to pack this in here, and now you pack it down. I take an amalgam plugger and pack it, and then I rub some more of it on the side of it. Then you go over to the other side of the tooth and the mouth, and we'll do one just about the same size. And you'll cut it down. Cut around this. I need to smooth some more back in here, then smooth the tooth off a little bit up here. Now, if you think, well, I don't want to do this pulpotomy, I'll just trim off enough to get, and you get close to there, that tooth will give you a fit. It'll be so sensitive. If you go and do these pulpotomies and you need a little additional room, you come back and grind on the tooth. They never give you any trouble. They come out, the body eats the root away, leaves the zinc oxide and eugenol, and it'll come right on out with a tooth in there. Now, I'm going to watch nature move these teeth into place. It's going to take these and move them over here as that straightens out. You've got the tongue pressure from here and the lips from over here, and that is the best diagnostic thing you can get. That's where those teeth in that mouth on that person need to be. I don't give a hoot whose diagnostic system you work. There's a whole host of them. They cannot tell you exactly where those teeth ought to go, because they're going to go where the force from the back and the force from the front balance out, and that's where the teeth go. And you can't find it out from cephalometrics. It may help you do a lot of other things, but just forget about that. Now watch this go as we go through here. I've been preaching on this thing for years, and people seem to be afraid of doing it. I've not run into too many people that are still doing this. We've published it, and you can get the paper on it, and you can read the whole article and stuff that we did years ago. And I've been lecturing on it for, 40 years. And here we come in and do the same thing on this tooth over here that we did on this one. And we're going to pack the zinc oxide eugenol. Now here I show the amalgam plugger. We actually plug this stuff in and push it down in there and smooth this off with some more and kind of smooth the tooth off so it doesn't cut the tongue or anything. All right, we're going to go on to we aspirate out, but clean it out. Now here we come back. This is 477, and I don't remember exactly. Don't have the date on that picture. But in a month or two or so, maybe more than that, all you got to do is wait on it. The tongue has moved this tooth into this position. Now you watch this midline is off here. You watch the midline correct. And we're going to come back, we're going to do some work on the top ones too. All right, we're going to see the tongue move that out and the lips caught it. And that is the best way to find where those teeth want to be. is let nature put them there. All right, now we look at the top, so we're going to have to do the same procedure. I think we cut it kind of at an angle up here, and it'll straighten the top out. All right, the bottom now is almost over. It just takes up every bit of this. If you need some more, you could trim it, but just leave it alone. You've got a little more over here, and watch this move in this direction. Now, I haven't touched them with any orthodontic appliances or any of these lingual arches or anything, nothing. Just let the tongue and the lips. So you got to start working with somebody who doesn't have a bunch of thumb sucking and mouth breathing, and if you've got problems with it, you can still do this. It'll still work to some extent, but not just ideal. Now, here we go in and we're going to, I don't know what this is, coming in across there. It's a piece of, looks like wire, but those teeth are moving in that direction. And we do the same thing up here on the top. So we've done 4 of these. And you can get where you can filtrate around. A little drop of anesthetic and come on inside, put a little bit, and then you come back and put a good bit on there, and you can deaden this too by just around this area, and you can take that down. Now watch this midline now. See, we still got space over here. So let's, all right, now when I bring that together, this is a little bloody, but just aspirate. Now there's where we started, and that's where we cleaned off, would clean it all off. And here it is after a month or 2, or maybe 2.5, 3 months, something like that. It doesn't take too long, though, for the tongue to come in and push these teeth around. It'll push harder right here, and this tooth will straighten up. And as it does, this holds it in place. It'll move over and take the teeth over to the side. Now, people just don't believe this, but try it, and it works. All right, we go on here, there's 2 of 78. You're just trimming these teeth. You're seeing the person all the time. Now we've got this one almost all the way over here, so that's moving in that direction. Now we're up above. These are straightening up pretty good. We're going to have pressure here, and the lip pushes here. It'll push this up against. If you need a little more, you can go in and take it off. These teeth don't bother you. They just sit there and stay there. You smooth them up so they don't cut the lip or anything. All right, the bottom has gone to this point. It's still got a little play over on the other side. And so here we come back at 79. Now this takes some time to do, but you just see this person off and on, then watching their teeth come in. A person in orthodontic school is not there long enough to do one of these cases. See, it takes several years. You just see them back and forth, and you come in and take this down, and watch this, what it does here now. All right, the upper is lining up pretty good. In fact, now we've got this much left over here, but it's lined up. This is a moderately crowded case with no deleterious habits or problems, and they breathe through their nose. Okay, now on the bottom, this tooth is now, it's almost time for the second phase of this. This deciduous first molar, the cuspid comes in, and it's kind of blocking this, keeping it from sliding over this way, but it's putting pressure over here. This tooth is coming in back here. Here's the cuspids now coming in. Now, what are you going to do here? we're going to make room for the cuspid and the first bicuspid to come into the mouth. And we lack a little bit over here. We can look through a Panorex x-ray and see how much to take off. So we're going to take this much off of this deciduous second molar right here. We go in and take a burr and cut that off. We're going to extract this tooth, and we're going to take it out. Now watch when I remove that tooth, cut that other one down, and here we've taken this out. Now we're going to cut this off right here, and we're looking at this cuspid. It's going to come out about here, and then the bicuspid will come in here, and we're going to trim that, and that bicuspid will hug that wall, and we save enough for the second bicuspid to erupt in there. Okay. Now take that same burr and clean it. Just cut this tooth off right here, and I infiltrate around and get it good and numb, and we put the aspirator in there. We're going to cut right down through it and take like the crown of that tooth or something like this. The roots go out to the side a little bit like that, and we're going to come down and cut it about like this. And this bicuspid will come up in here, and then the thing will just slide over, and the bicuspid will be sitting right in this area. It'll eat this part of the tooth away as it comes in. So now watch this. And we cut it, trim it back. Now take a long shank, about a number 4 round burr. This is, and on a long shank, I can come right in here. You don't care if it's decayed a little bit. You can go in here and you're going to hollow this tooth out, and you're going to go up and go down both roots a little bit. So here we go. We'll take that and run it in there, and then you turn it down and come out, turn it down in that root, and trim that off. Now we do the same thing with this. This zinc oxide usinol is so thick, we have squeezed all the usinol out. We can pad out of it, and it's like thick putty. In other words, you pack it like amalgam in that tooth. So we take that, we've opened this out, don't worry about it, it's bleeding some. You put that stuff in and you pack it in there. And so we shove it up and fill that in and pack it. Now get in there and put pressure on it. You're going to squeeze it down the horns of that tooth. And I've done hundreds of those teeth. I know several hundred, probably just oodles of, and I, honest to God, have never had one of them blow up. And you can't say these are healthy teeth. I wonder sometime if you'd pack this in a permanent tooth and just drill down in there and pack that full. Now, when the erupting tooth comes up, it eats the roots of this away, and the zinc oxide usinol has no deleterious effect on the cells that are eating the. I've had these teeth come out with just a shell, and they come out, the dentin is completely gone in the teeth, and there'll be some zinc oxide usinol still in the shell right there. Don't put anything else in there, it won't wash away either. I think you put a bunch of real strong stuff in there and it squeezes out, probably affects the cells at the bottom of this tooth. But this doesn't have any effect on the erupting cells that eat away the deciduous tooth. It comes on in straight. So now the girl kind of looks at you and says, "What the devil are you doing to me?" And after a while, they say, okay, you've gone in here and worked on it and you've got that tooth. She wondered, why do? All right, now let's look. Look at this midline. I mean, it's right dead center, right there. I have not put one instrument in there to move that tooth over. Look where these teeth. That cuspid came in, let this come up here, push this over, and this tooth will fall right into that cut where we cut this out. This one will too. And now there'll be room for the second bicuspids to erupt in the mouth. We didn't do this overnight. Here it is, 1979, and I think it's a couple of years, so I don't pay much attention to the time of it. Now, I wish you'd leave the kids alone and let them chew and gnaw bones if they want to. I mean, we make them cut the meat off and don't want to let them gnaw and chew on something, and we wouldn't have as many deep bites as we've got. But even with that, this worked good. Now, here these cuspids, we cut the, well, this is the deciduous cuspid we cut out. This is where it started, and this is how it straightened out. Now that, I have not touched them. Look where this bicuspid, first bite came in and took this space. And this one over here will come in and take this space up too. And the root is more narrow than the crown. It'll fall right into place. All right, there's the second bi in place. And this is a permanent cuspid coming through. All right, we took these out and we cut these off on the top and bottom too. Now, this is where these teeth want to be. Oh, what's happening to my little pointer right here? Let me get this going again. Oh, it's all right. This is where these teeth want to be. There we go. Now, I haven't done anything supplementarily or anything else. I let the nature put those teeth where they are. I've got ample room, more room than I really need right here for this to come out. This will come out and the second bicuspid will come in that place right there. Now it's not perfect, I mean these aren't, but that'll get better and that'll go as if you don't do anything else to the teeth. Many of these will work out where you don't have to do any orthodontics whatsoever. Now that doesn't happen very often, but every once in a while you can see these permanent teeth have lined up in here. You couldn't put them in there better. And your tongue has put them over here, and the lips have caught them on this side right here. And that's let nature do its job. We are marvelously made, and that's what takes care of. If a person has a little more room, they might come in this way. I never have seen a tooth that erupted in the mouth where it ought to be. It usually comes in and gets pushed into place, everything. So this is something I think everybody who works on kids ought to know how to do this. You don't, I mean, this is better orthodontics than the most expensive stuff you could stick on somebody's mouth. And it costs you nothing. I mean, except just doing the work. on the case. And here is this young lady after we got through. I don't know if she's got something hanging on one side of the mouth there, but here is the smile. This is a facial structure of normal breathing, everything else on this young lady. And if I'm not mistaken, this young lady grew up, she married, and she had a child, a little girl, and she was living in another town and brought her child back and said, I want you to do this to my child so she won't have to go through orthodontics with braces and everything on her teeth. Now, they don't all come out this good, but even if they've got breathing habits and other habits and things, and you can do this and they come out better, but you'll have to come back and finish them up, which is not a bad thing to do. And this is why I say that pediatric dentists who do know orthodontics, shame on you. I mean, the people that are leading them, the pediatric dentist ought to be doing early interceptive pediatric orthodontics to start with. You don't have to be sending them back and forth, or you don't have to go hire an orthodontist to come over and work in maybe 3 or 4 pediatric dentists will hire somebody. But you know, you get the orthodontist. He hasn't been through this type of stuff. It takes too long in here. So very few orthodontists are trained to do pediatric stuff to start with. They can learn it, of course. They do it like anybody. So I'm signing off, and I'm saying, start doing this. I mean, this is a simple way. You do not need the rubber dam. In fact, you can't use a rubber dam. You get it tied up in all this mess. And you can go, and I've never had one of these teeth that backfired and blew up on me at all. I worked on good, healthy teeth and just use a new burr whenever we go in to do this. We'll go in and do this, and I've never had one of them blow up. And that's an actual fact. So I'm going to say goodbye, and I hope you'll join our group. And we have, I've got everything I can think of out there that people can do. And so join our group. We have several, what do you call them, bands of videos going. So thank you for watching. I'm going to close out.